Hi family, welcome to our channel. My name is Irene, together with my daughter here, SELAHJOY. So we are here today to share about her disability story. We hope that it will encourage someone out there and give hope to someone who is going through the same condition. And even if you're not going through the same condition, remember, we want you to be an ambassador out there. You may be able to help someone with the same condition. So today I'm going to share about the signs, some of the signs and symptoms to look out for in a child with this genetic disorder. So if you're interested, please keep on watching. SELAHJOY has a condition called spinal muscular atrophy. Spinal muscular atrophy is a rare genetic disorder that robs a child of its abilities to breathe, walk, or even sit. And remember, the disease is progressive. It is categorized majorly in 3 types according to severity. So type 1 is usually discovered between 0 and 6 months old. Type 2 is discovered between 6 months and 18 months old. And then type 3 is discovered after 18 months of age. Now, every person has what we call an SMN gene, which is survival motor neuron, which is responsible for one to gain their motor skills, like for example, walking, sitting, and other skills. But now in these children, usually this SMN gene is deleted in them. So you find that they are not able to gain these abilities just like any other child. That very SMN gene, the survival motor neuron, is one that helps the children to build muscle. But then because remember the SMN gene is deleted in them, their muscles are not able to grow like any other child. Now remember, most of our bodies are composed of muscle. Almost everything you think about has muscle in it. With baby Joy, we actually did not discover it until she was 6 months. I had a very normal pregnancy. If you're interested in watching her whole story, I'm going to link a video where you can be able to watch the whole story. I met all my antenatal appointments. My pregnancy was, if what I may call, smooth. When I gave birth to her, she weighed 3 kilograms and she met all her tests. However, around 5 months of age, that is when I realized that there was something funny about the child. So someone recommended us to see what we call a ped neurologist. So when we met with a ped neurologist, he advised us that we run the test. Remember, these tests were not in Uganda, so we had to send a test abroad. And when the results came back, she was actually having spinal muscular atrophy type 2. When we got to know about it, the doctors told us there was nothing much they could do. So she delayed a little bit in picking up with her speech. And then even now, at 3 years of age, her words are not that clear. But then we are doing occupational therapy at the moment. When she has issues with coughing, you hear her coughing in a weaker way, like so usually that is what she does. So even with the flu, sometimes what I do is I help her hold the nose and try to kind of like giving some bits of light pressures on them. But anyhow, once in a while we give her a nebulizer to loosen up the mucus that is in her system. She can sit up. She can also feed herself with, when you give her light pieces of food, she can be able to feed herself. But then if you give her a normal meal, her swallow is very weak. So you really have to take a lot of time to wait for her to eat and finish up all her food. So currently, those are the challenges that we are facing with baby Joy. If you've watched this video, please do not sit with this knowledge of information. Try as much as possible to help someone out there. Not very many doctors know about this disease. Actually, what is even interesting is that there hadn't been any form of medication for these children until like a few years ago. That's when some of the drugs were discovered, and even then they are still on trial to educate people out there. And remember, with her kind of condition, early treatment is key. So that's why we are sharing her story. Hope you've enjoyed this video. Please don't forget to subscribe, like, comment, and we hope to see you in our next video. Bye.